Pilot Assistance Program is based off of a national policy that the Airline Pilot Association National has gone out to kind of protect and watch over both pilot performance and health-related issues as a pilot's going through his daily life and his career. So we provide support. We're not counselors, we're not medical professionals, we're just peers, same level, that provide support to pilots when they find themselves in some kind of issue, whether it be professional or health related, or something that is a stressful situation that they were in. We provide some support for them at the lowest level possible. Pilot assistance really is focused on dealing with human stress and the stress of a job. Aeromedical is a big stressor for a professional that is required to be certified, such as a doctor or a pilot. He has to have an FAA certification. So even a minor issue to some people may be a career-stopping issue to a pilot. So aeromedical finds itself as a key point when we're dealing with stress and pilot assistance. The second most concerning one is the one that we all deal with, and that is death, would be grief. A pilot, either a loss of a pilot, so therefore we have to deal with the family, or the loss of a friend within a family. All of those are grief-related areas, and grief is, again, another big one for the human. Just as a person, it can have such stress upon our day-to-day efforts. So we help people deal with the coping with stress, and that's our bereavement. The third one is if you were to have a critical incident, something major in your life. For a pilot, it would be an incident in an airplane, or it could be an incident in the family. But that critical incident also plays heavy, and the normal coping skills that a person needs to recover are individually oriented, but they can be either short or very long, and we kind of try to help that pilot find those coping skills and utilize them so that he can quickly get back to what he wants to do most in his life, and that's usually fly airplanes. And secondly, deal with his family and help his family. The third one is a little bit more structured, and that's goes along with the medical, and that's a substance abuse or alcohol, but substance abuse covers a big area. And there is an opportunity in the aviation field, at least, for a pilot who has been diagnosed with a chemical dependency to find his way back into his career. And that requires an FAA support, an FAA recertification process, but it is a working process. The good news, I think, is the numbers are low. The even better news is those people that find themselves in that situation can recover and get back and be fully qualified and continue their career. So that's why it's a biggie from my point of view. And then the other one is professional standards. Professional standards, and that's where my length and depth of experience is flying with a hard-headed pilot, flying with one that was unable to bend one way or the other and compromise, and having an opportunity through the professional standards to talk to that person in confidence, or get someone else in to help talk with that person in confidence, to bend his way of doing things so that it would be more pleasurable for both people involved. We're not trying to make everybody friends. We're just trying to make them so that during the period of time that they're professionally involved in that airplane, they're not at each other, but safely flying and working together as a team. So 5 different stressors. Some are just in our day-to-day routine with people. Some of them are medically oriented that come at us, but all of them are very serious to the success of that man or woman continuing what they do and what they do best, and that's fly airplanes. And we want to give them every opportunity to do that. What we do in total confidence for the protection of the reputation and the protection of the rights of that individual. The greatest support to an individual is his family, and usually his church, and whatever real close professional association he's with. And if that family is not there, if that church is not there, then I think it's adamant. It's a highly important emphasis that association, such as this pilot association, is there to capture and help that individual when those others aren't available. Those others, I think, are the primary, but there's got to be the tertiary when they're not there. The company has a better understanding of what we do for the pilots sometimes than the pilots. And in fact, in the field of aeromedical, critical incident response, professional standards, and well, especially HIMSS. The company, flight management, duty officers, flight training, flight standards, they're very quick to come to the association and come to pilot assistance when there's a pilot in distress. If there's a pilot in distress, they look for the first and quickest avenue for that support, and they will utilize us. So we have a good relationship in terms. And again, those relationships go strong and go weak depending on as management teams change and people change. But I can say after all these years, we have a very strong commitment and a strong relationship right now with our flight management to allow us to help in mitigating suffering or mitigating stress and concern by a pilot. So it's working better and better. And that's, again, optimistically, it would be a lot farther along than it is, but if we are in the right track. The Pilot Assistance Program can be identified. It's on the website. There are 5 of us. Any one of us can be reached, and our names, our emails, and our phone numbers are listed on the website. So please visit the FedEx MEC ALPA website, go under Pilot Assistance, and choose who you would like to talk to, but come forward and talk to one of us about the opportunities and the gratification, truly the personal gratification of working in my committee.